What's up, everyone? Today I'm doing a rapid review of sickle cell disease. Sickle cell disease, or SCD, is an autosomal recessive hemoglobinopathy caused by pathogenic variants in the HBB gene. The classic form results from homozygosity for the HBS variant, but sickle cell disease can also occur when HBS is inherited with another abnormal beta globin variant, such as hemoglobin C or beta thalassemia. The underlying pathogenic variant causes a substitution of valine for glutamic acid at position 6 of the beta globin chain. This produces hemoglobin S, which polymerizes when deoxygenated, causing red blood cells to become rigid and assume their characteristic sickle shape. Because of this defect, sickled red blood cells can obstruct small blood vessels and undergo premature destruction. As a result, sickle cell disease is characterized by two major processes. The first, vaso-occlusion, leading to ischemia and pain. The second, chronic hemolytic anemia, due to ongoing red blood cell destruction. The classic presentation often begins in infancy after fetal hemoglobin levels decline. One of the earliest manifestations is dactylitis, or painful swelling of the hands and feet. As patients get older, they commonly experience recurrent vaso-occlusive pain crises involving the extremities, chest, abdomen, or back. A high-yield feature to remember is functional asplenia. Repeated splenic infarctions cause progressive loss of splenic function, often in early childhood. This dramatically increases susceptibility to infections from encapsulated organisms such as Streptococcus pneumoniae. If the disease progresses, numerous complications can occur, including acute chest syndrome, characterized by a new pulmonary infiltrate accompanied by respiratory symptoms, fever, chest pain, or hypoxemia. This is one of the leading causes of mortality in sickle cell disease. There's also stroke, particularly ischemic stroke in children, which is why transcranial Doppler screening is recommended in high-risk patients. There can also be splenic sequestration, an acute enlargement of the spleen with rapid pooling of blood that can progress to shock. And lastly, you can also see symptoms such as priapism, pulmonary hypertension, kidney disease, gallstones, and avascular necrosis. Diagnosis is established by identifying significant quantities of hemoglobin S on hemoglobin analysis, such as hemoglobin electrophoresis, isoelectric focusing, or high-performance liquid chromatography. Molecular genetic testing can confirm biallelic pathogenic variants in HBB, including at least one HBS allele. Newborn screening programs routinely screen for sickle cell disease throughout the United States. Management includes both supportive care and disease-modifying therapies. Key strategies include hydroxyurea, which increases fetal hemoglobin production and reduces vaso-occlusive complications. Infection prevention, including prophylactic penicillin in early childhood and appropriate immunizations for functionally asplenic patients. Red blood cell transfusions, which may be used for stroke prevention and treatment of severe complications. And curative therapies, including hematopoietic stem cell transplantation and newly approved gene therapy approaches. And that's your rapid review. Hit that like and subscribe button for more quick study tips, and I'll see you next time.